Howdy everybody. In today's Poop Tip Tuesday, we're going to go over a couple different things. Number one, we'll talk about, is it safe to do elective procedures during this time with COVID-19 and everything else going on? Number two, we'll answer the question, can acid reflux cause chronic cough? Number three, we'll answer the question, why are you so tired after you poop? What is going on? Is that normal? Is that abnormal? Number four, we'll talk about how you can improve your liver. Number five, we will talk about, can a hiatal hernia cause aspiration? And number six, the very end, I'm going to give you a big announcement, a new change you're going to have for what's going on with me and for you guys as well. So for those guys who are joining for the first time, my name is Dr. Islam, and yes, I'm an actual poop doctor. Yes, that is what I do. My passion is to give you tips and tricks to help out with your gut health. If you haven't already, don't forget to smash that like button. Like, share, and subscribe so all the social media people know exactly what you're doing. And if you want to have me answer a question live, put it in the comments down below. Or if you're not comfortable with that, subscribe to my weekly newsletter. I'll put a link down below where you can send me a message or send me a DM and I can maybe answer those questions for you. I need a huge favor from you guys. Number one, let me know where you are watching this from. And number two, let me know if you're watching it live or on the replay. Amanda, it's great seeing you on today's live video. So let's answer the first question. A patient asked me, hey, Dr. Islam, is it safe to do elective procedures during what's going on in COVID-19? So this is a very difficult question for us to answer because we all know that there's a lot higher rate around this area, especially in Lubbock, for the rates of COVID-19. But we also know that people need to get their procedures done, whether it's your knee replacement, your hip replacement, your gallbladder surgery, maybe your colonoscopy or upper endoscopy. These are things that need to get done because routine medical care or even care that actually causes symptoms need to continue to occur because we don't want things to get worse for what's going on. So my suggestion is a couple things. Number one, speak to your healthcare provider about what some of the risks are with you having to do these procedures. I will tell you for my case, it has typically been a very safe option for our patients. We screen everybody who comes in. We also all wear face masks. We all gown up. We all make sure we do things very safely for you. Also, number two, if somebody is having a symptom, so for example, things are getting stuck when they're eating, that can't wait. Because that is a really significant problem, and that's an issue that a lot of people have, and we have the potential to fix that. Or if you're bleeding, we can fix that. Or if you have a problem with your knees, that can be fixed as well. And so it's hard for me to answer in an individual basis, but I would say make sure you speak to your healthcare provider about what some of the risks are. Do you have any comorbidities? Are you at high risk for having complications from possibly COVID-19? And what are the protocols in place to keep you safe? Cruz, is great seeing you. B, is good seeing you as well. Angela, good seeing you. Pam, is good seeing you. Thanks for watching in Shallow Water. Mr. Myers, good seeing you as well. And thank you guys for watching on today's live video. All right. Question number two, I got from a DM on Instagram from Sayan who said, can a dry cough be due to acid reflux? Well, the answer to the question is yes, it can. So reflux can manifest in a lot of different ways. For some people, it can be typical reflux or heartburn where you feel that burning sensation or regurgitation. Number two, it can also be sometimes that pain that you have right here. Let me know in the comments down below, have you had symptoms like that when it comes to acid reflux? Because that's a very common symptom people have. But there are non-typical GI symptoms from acid reflux. Sometimes you can have nasal congestion. That could be a symptom of reflux going up into your nose. You can have a chronic cough that can be due to acid reflux because that acid going into your lungs. And you can have asthma as a symptom from acid reflux as well. Let me know in the comments if you felt that or if you've known that acid reflux has caused that. Because reflux can cause a lot of different symptoms. There are some people who have acid reflux that can have actually ear problems. That acid goes all the way up into their inner ear to cause ear infections to occur. And so there are a lot of symptoms that can be due to acid reflux. Even though you may not have the typical symptoms from acid reflux, things like cough can certainly be due to that as well. And one of the things about having a hernia is that a hernia can make it more likely for you to have acid reflux because it traps acid beyond where it should be. And that trapping of the acid can cause more acid to reflux up to cause cough, burning, regurgitation, ear infections, and other issues going on inside your GI tract and also outside your GI tract. Great question that I got. Gail, it's good seeing you. Thank you for watching. And Joy, it's good seeing you as well. And thank you for watching as well. So, question number 3. This is a great question. This is a question I got from a DM from Kayla, who says, "Why am I so tired after I poop?" Have you guys felt this? Let me know in the comments down below. Have you felt tired or know somebody, maybe a friend of yours, maybe it's not you, maybe it's a friend, who feels tired, just exhausted after they have a bowel movement? What is going on? Well, the most common reason is called a vasovagal reflex. So let's go over the process of actually using the restroom. So here's what happens, and you guys know this. Whenever you use the restroom, you squeeze those abdominal muscles really tight to push things out. That squeezing of the abdominal muscles causes your vagus nerve to be contracted. Your vagus nerve is part of the parasympathetic system, in which you have kind of the relaxation of things and things slow down and you're not as hyped up. But in addition to that, that squeezing down and that stimulation of the vagus nerve can actually decrease your heart rate. So your blood pressure drops, your heart rate gets lower. And so whenever your blood pressure drops, you have less blood flow going to your brain. You also have more contraction going on, causing less blood flow to your brain. You're increasing your vagus nerve, and so you get this sensation of being dizzy or having a sensation of having some fatigue or tired whenever you have that vasovagal response. Very common problem that a lot of people have, and for most people it's not something to worry about, because typically it will go away on its own and will not cause any long-term problems. So if you are feeling tired after you poop, I can tell you, number 1, that's normal, and number 2, one of the things that you can do to hopefully get that taken care of is maybe not push as much as you typically do, or to take deep breaths and allow that blood flow to go back up into your head so you don't get that vasovagal response. You don't feel so tired, you don't feel as much discomfort, and you don't have as much issues when it comes to that. Great question. I love these questions like that. Dennis, it's good seeing you. Thank you for watching on the live show as well. Thank you guys for doing that. All right. Question number 5. Can a hiatal hernia cause aspiration? Well, aspiration is one of those common symptoms when it comes to acid reflux. And what happens is that acid goes up, 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 and eventually you can go into your lungs. So just like it can cause a chronic cough, it can also cause you to aspirate as well. And some people can actually have what's called aspiration pneumonia from acid reflux, or sometimes the inability to completely swallow correctly. So if you have a hiatal hernia, that does make it more likely for you to develop acid reflux. If you have more acid reflux, that does make it more likely for you to possibly aspirate or have that reflux go into your lungs to cause chronic cough, chronic congestion, and also to have chronic lung issues as well. Let me know in the comments if you know somebody who's had that problem when it comes to acid reflux. Also, let me know if you have suffered from that as well, because there are a couple different things we can do to help fix this. Number 1, obviously, is putting you on medications to help control your acid reflux. Option number 1. Option number 2 is adjusting your diet. I tell a lot of my patients, if we can try to change your diet, we have the possibility, not guarantee, but the possibility of getting your acid reflux fixed. Diet plays a significant role when it comes to acid reflux. The things that we enjoy in life, unfortunately, our body doesn't enjoy us to have that when we have acid reflux. So things like coffee, alcohol, caffeine, chocolate, tomato-based foods, spicy foods, all the great stuff that we enjoy eating will make acid reflux worse. Comment down below if you're like me that enjoys those foods, because I love having that. And by changing your diet, we have the option of getting that fixed. But for some people, taking medications and changing their diet doesn't work. And they try other lifestyle things, avoiding laying down late at night, sleeping upright, having small frequent meals, waiting 3 hours before your last meal before you go to bed. They try these things, nothing works. Then sometimes for those patients, we have to do a surgical treatment, maybe even fixing that hernia that's there. And there is a little bit of a workup that we'd have to do to make sure that you are the right candidate to get your hernia fixed, to fix your acid reflux. And based on that, we can know if we can get your acid reflux potentially cured by fixing that valve, fixing that hernia, and preventing acid from upchucking up and causing worsening acid reflux. So it is really, so a hiatal hernia can cause acid reflux. Excuse me. Sean, it's good seeing you as well. And yes, This is a great comment. Aspiration is horrible. Actually, it is horrible, and it does feel like that you are choking to death. It is a very common symptom. It's the reason why people actually may not actually be able to sleep very, very well at night. They have that sensation that they're aspirating, and whenever you aspirate, you wake up, and you may not realize that you're putting one and one together, and that your cause actually may be due to acid reflux. And for those people who have just really bad acid reflux that we cannot control, and we can't control with either diet, we can't control with lifestyle, or we can't control with medications, then the option is to hopefully get that acid reflux fixed and to get it cured as well. And for a lot of our patients, it actually makes them feel very, very good. Hey, thank you for watching from San Antonio. LBDLF. I don't know what that stands for, but thank you for watching from San Antonio. Appreciate you tuning in on today's live video. So these are some of the great questions I got from today's live video. So if you guys don't have any more questions, I am going to give you my big announcement. All right, big announcement. This is an announcement I've been waiting for quite some time, but what I'm going to let you guys know, especially those of you guys who see me in the office, is that we're moving. Yes, we are moving. We are moving to a new office space. Yay! Yes, I am so excited. You'll see announcements shortly on my social media pages. We are moving to a new location on 82nd Street, 4505 82nd Street, starting on January 2021, in about a month's time. Yay! So all the great care that I hope that I give you guys will be in a new clinic. This clinic will have better parking. Yes, I know parking's a pain. It'll be better parking. It'll be away from all the things that are going on in the healthcare systems. There'll be a separate clinical office away from that. We'll have better parking, easier access. It'll be more towards what's called South Lubbock now, around 82nd Street and Quaker and Slide. I am so excited to share this with you guys. You guys are the first, yes, the first to know about this. And I'll be posting more on social media about where it's going to be, how the location is, when we're going to start opening, which should hopefully be in the very beginning of January. Don't worry, every single one of you guys who've been seeing me in the past will continue to still see me. I hope you guys will come follow me. I'm still saying the exact same insurance, and we are expanding our insurance providers to also take insurances from Covenant and First Care as well. So we are so excited to have this new move. I want to thank you guys for this, and we'll be giving more and more information with that as well. So thank you guys for watching on. That's my big part of that. So thank you guys, appreciate it. So a couple questions. So Margaret, good seeing you. Thank you. Gail, it's good seeing you. Thank you. Mr. Works, yes, absolutely. 100% I'm going to be part of UMC. Absolutely. Absolutely, I will be. Yep, B, exactly. So at Texas Tech, exactly right. Yes, ma'am. Just a new location, and that's it. Cruz, good seeing you. Thank you guys so much. I'm so excited for this. I know that with everything going on with COVID, the fears, the parking, we decided it would be a good idea for us just to shift to a different area, closer to our patients, and hopefully get the care that you guys want. So thank you guys for watching today. I hope you guys had a great Thanksgiving last week. If you haven't already, do me a favor, smash that like button, like, share, and subscribe. Share this video. If you know somebody who has acid reflux, share this. If you know somebody who has some problems pooping, or maybe feels tired after pooping, share this. If you know somebody who's had a hernia, share this as well. And I want to see what we can do to hopefully help out our patients. Guys, thank you for watching. Hope you guys have a happy and healthy day. Take care.